Hello, and welcome back to the Medical Weight Loss Show. I'm your host, Dr. Andrea Walker, family nurse practitioner, IFBB Pro, and owner of Serenity Health Innovations and Wellness, located right here in Central Florida. On this show, we talk about real weight loss, real bodies, and real expectations. Not hype, not shame, and definitely not quick fixes. With that being said, today's episode is an important one. We're talking about why it's not a great idea to yo yo on and off GLP-1 medications and why many people notice that these medications don't seem to work as well the second, third, or even fourth time around. Now, that's not true for everyone, but this is something I've personally observed for years in clinical practice and something many of you listening have lived through yourselves. So, if you've ever thought it worked the first time, but now it's different, this episode is for you. So, I want to give this short disclaimer before we get started. This podcast is for educational purposes only and is not medical advice. It does not replace care from your personal medical provider. Always consult with your healthcare professional before starting, stopping, or changing any medication or treatment plan. Now, let's get started talking about what I commonly see. A patient starts a GLP-1 medication. They lose the weight, they feel great. Then, for one reason or another, maybe it's cost, side effects, vacation, life stress, mindset, whatever, they stop. A few months go by. The weight comes back, often faster than it came off. So they restart the medication. And suddenly they're saying, it's not working like it did before. I'm still hungry. The scale isn't moving. Maybe it's the place where I'm getting the medicine. It's not effective. And that's incredibly frustrating, I know. But here's the truth I want you to hear clearly. The medication did not fail. Your body adapted. GLP-1 medications work by enhancing a hormone that helps regulate hunger, fullness, blood sugar, and insulin. For many people with obesity or metabolic dysfunction, this hormone system does not work properly. So when you stop the medication, your body doesn't go back to baseline. Instead, hunger hormones surges, satiety signals drop, cravings intensify, blood sugar control worsens, metabolism slows to protect fat stores. That's why so many people say, I'm hungrier than I was before I even started. It's not weakness, it's biology. When GLP-1 support is removed suddenly, the body goes into defense mode, trying to regain and protect weight. So let's talk about why GLP-1s take longer to work when restarted. It's not that they don't work for the most part, but they may take longer to work. And this is where people tend to mess up. They tend to give up too quickly. With repeated exposure, GLP-1 receptors in the brain can become less responsive. Just like caffeine or certain pain medications, your body remembers. So the appetite suppression may feel weaker, even at doses that worked beautifully before. I know for myself, when it comes to caffeine, a lot of people drink caffeine, people who are not used to drinking caffeine, and they're bouncing off the wall, right? Myself, I drink 1 or 2 cups a day. I can drink caffeine and go straight to bed. I can drink caffeine, and caffeine actually relaxes me. It's kind of that same concept of the GLP-1 receptor adaptation. So I hope that makes sense. Caffeine doesn't do for me what it would do for someone who's brand new starting on it. GLP-1s will work wonderful when you first start it. But once your body adapts to it, just like my body has adapted to caffeine, the outcome can be different. Make sense? Now, metabolic adaptation. Weight loss lowers your resting metabolic rate. When weight is regained, it's often more fat with less muscle. Most people are gaining fat and not muscle when they're gaining weight. That's just the way it works, unfortunately. Each cycle makes the body more efficient at storing fat. Not what we want to hear. And it's less responsive to future weight loss attempts. Let me repeat that so you get it. Each cycle makes the body more efficient at storing fat and less responsive to future weight loss attempts. And then, of course, there's that loss of lean muscle. I always try to stress this to my patients. Many people lose muscle during rapid weight loss. When you regain weight without rebuilding muscle, your metabolism stays lower, medication response is blunted. GLP-1s work best in a body that's being fed adequately and trained intentionally. So, for the people in the back who don't want to eat because you enjoy not eating because your GLP-1s are working wonderful and you think that's great, I tell my patients all the time, I need you to eat and I need you to work out. Yes, you can lose weight and you don't have to eat protein and you can eat terrible and you don't have to work out, but you're going to have loss of lean muscle. And if you get off these GLP-1s and you come back 6 months or a year later, I'm going to have to listen, or a provider is going to have to listen and try to explain to you why your medication is not working as well this time around. So please, please, please feed your body adequately. And even when you can't eat, prioritize your protein and work out building some muscle while you're losing the weight. Next, insulin resistance can worsen. Weight cycling increases insulin resistance over time, and GLP-1 medications rely on insulin sensitivity to work optimally. I'm not talking about your regular labs at your physical exam when you come and tell me, oh, my labs are normal. Those are not the labs I'm talking about. I'm not talking about your liver and your kidney. That's great. Starting with your thyroid is a great start. But now I want to look at your estrogen. I want to look at your progesterone. I want to look at your testosterone. Yes, your testosterone, even for women. And yes, even men. I want to look at your estrogen. I want to look at your all of that. And then there are other things. We want to look at cortisol levels. So a lot of times you will not get these labs drawn at your primary care provider. You will have to reach out to sometimes some telehealth companies do it. A lot of times if you go to individual like wellness clinics, med spas, people who are into like metabolic health, that's what we do. At my practice in Central Florida, we look at all those things. But you want to get your hormones checked. That could be the issue. And then just overall unrealistic expectations leading to inconsistent use. That is huge. I hate to be Debbie Downer, but a lot of patients are jumping on these meds for 3 months, 6 months, and saying, I'm ready to get off of them. I'm only going to be on them for 3 months. I only need to lose whatever. Unrealistic expectations is a huge issue. These medicines were never designed to be short term medications. There is a medication called phentermine that many have heard. A lot of times we prescribe it long term, chronic, it just depends. But that is a medication that was designed to be short term. That is your medication that you go to and you say, I'm only going to take this for 1 month, 2 months, 3 months. GLP-1s were not designed to be that. Yes, you can say, I'm only going to do it for 1 month, 2 months, 3 months. You can say, I just need a jump start. But I've said this before and I'll say it again. even with that jump start, these medications do work wonderful. You will never hear me call them a miracle drug, but they work wonderful. They do so much that you cannot do regardless of how you eat or work out. And so when you stop taking them, you're not going to get those benefits, regardless of how you eat or how you work out. So it's just like I've said before, it's like taking a blood pressure pill. You take that blood pressure pill, your blood pressure is beautiful. Your blood pressure is now 115 over 70. You stop taking that blood pressure pill and you have a diagnosis of hypertension, your blood pressure goes back to being 180 over 110. Why? Because you're not getting the medication. When you took that medicine, you had that quote jump start. Yes, you can diet, you can exercise, you can eat all the right foods. Will there be people who can come off those medicines? There are. A lot of times we will say it's genetics. I hate to say it, but sometimes no matter what you do, yes, you can improve your blood pressure, but you're still going to have to be on something. Yes, there are some people who will be able to come off of it, but the majority will have to stay on it. Same thing with the GLP-1s. If you stop taking it, guess what? Whatever you were experiencing before you were taking it, that difficulty losing weight, no matter how much you worked out, no matter how well you ate, you still struggled with weight loss, you're going to go back to that. Even when you lose those, quote, I only want to lose 10 pounds, and you lose them super quick with the GLP-1, you're going to gain them super quick when you stop taking that GLP-1. So, GLP-1s amplify consistency, they do not replace it. You do need to continue to take them. Now, obesity, it is a chronic condition. I hate to say it, but it is. We don't shame people for staying on these medicines. I know there are a lot of people don't want people to know they're on them, and they're like, oh yeah, I went to the gym, I worked out, I changed my diet, and that's how I lost the weight. Well, okay, wonderful, whatever. That's great. But for those who don't mind acknowledging that, yes, I did go to the gym, I did change my diet, I did learn modification, but I took these medicines, and that's really what did the weight loss. Then, there's no need to be shameful about taking the medicines, but I know that there are people out there who will make you feel bad. But the way I see it, you're just going to have to get over it because they are wonderful medicines and they do a lot. They have helped so many people. But obesity is a chronic medical condition. Some people, and when I say some, I mean a lot, like many, like most, will need GLP-1 support long term. And here's the thing, you may not need to take it every single week, especially when you hit your goal weight. There's what we call microdosing, and there's all sorts of ways to do microdosing. There's every other week, there's lowering the dose. That's the beauty of the compounding versions. You don't have to take it weekly. You don't have to take a set dose. We can lower your dose to the dose that's catered exactly for you. So that's a whole nother podcast and an episode. But just know that there are options out there. You don't have to come off these medicines 100% completely, and you don't have to take them every single week, as they were originally designed. But that's more so once you hit your goal weight. So there are a lot of options out there. The problem is just when you get ready to randomly stop and you don't have a plan. So make sure you have that plan. But for now, if you're thinking about stopping the GLP-1, just think again. Make sure it's something you want to do. You want to taper it slowly, work with your healthcare provider, consider microdosing, Prioritize protein. Make sure you are strength training. Definitely avoid extreme calorie restriction before you stop the GLP-1. You want to learn about hunger awareness and cues. And then if you're restarting, stay consistent. And I'm talking about restarting the GLP-1. Remain consistent. Expect slower progress. Be patient. Be kind to your body. Focus on metabolic healing. Rebuild muscle. And manage your expectations and have realistic expectations. The goal is not to get off the medication as fast as possible. The goal is to stop fighting your biology. Now, in closing, if you've stopped already and restarted GLP-1s multiple times, you are not broken, so don't despair. Your body is doing exactly what it was designed to do, protect you. Weight loss isn't about willpower, it's about strategy, support, and consistency. If you like today's episode, please subscribe, leave a review, and share this show with someone who needs to hear it. And remember, make sure you meal prep your food, work out, and drink your water. I'm Dr. Andrea Walker. Until next time, be consistent, be patient, take care of your health. I'll see you next week.